I am Dr. Pawan Goyal. I am a senior consultant physician at City Heart Clinic and Medical Center Rewari. Currently, I am chairman of API Haryana and secretary of RSSDI Haryana.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
Basically, type 2 diabetes mellitus treatment has so many options these days. We have very old molecules like sulfonylureas and metformin, and currently we are having some new molecules, not so new also, like DPP4 inhibitor and SGLT2 inhibitors and glitazones also. But Imeglimin is a new class of drug. It comes under the class glimins, and it is a wonderful molecule. As far as I have used it for around 1 year, and I have been using this drug as an add-on in most of my patients when they are not controlled on regular OADs and when the patients are not willing to start insulins. In those patients, I have found very good results with Imeglimin in combination with the first-line anti-diabetic drugs, and I have found very good results. I have found very significant HbA1c reductions, as well as it doesn't have many side effects also.
In what specific patient populations do you see the greatest benefits of using Imeglimin?
Basically, Imeglimin can be used in any type 2 diabetes patients because it has got dual mode of action by providing increased insulin release like secretagogue action, and it also has actions which mimics actions of metformin, like decreased gluconeogenesis as well as increased glucose uptake by muscle tissue. So it has got dual benefits like sulfonylureas as well as metformin. So it can be used with any type 2 diabetes mellitus patients. But currently we have used in second line drug, not as first line drug. Although times 1 trial and times 2 trial, it has in times 1 trial it has been used as a single solo drug. In times 2 trial it has been used with the oral anti-diabetic drugs, and in times 3 trial it has been used with the insulins. So it can be used in any patient population for that matter, as first line as a single monotherapy, or it can be used as adjuvant therapy to existing insulins or oral anti-diabetic.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? You can share a real world case if any.
Basically, I have used Imeglimin for quite some time, and for last 1 year I am using it very regularly, and I have found it to be very good oral anti-diabetic drug with comparable efficacy as other anti-diabetic drugs. The HbA1c reduction is to the tune of 0.6 to 0.8 or 0.9 in most of my patients, and about the safety point of view, it is very safe. The side effects are almost negligible. It doesn't have many GI side effects or any skin side effects, and basically as compared to placebo, it doesn't have many side effects. So it is quite a safe drug and quite effective also.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
Basically, sustained release preparation provides a good release of a drug. That means it has got better pharmacokinetic profile of the drug, and because of good pharmacokinetic profile, we get a better glycemic control in most of our patients of type 2 diabetes. So and it also improves the compliance in most of our patients, because in diabetes compliance is a big issue in most of the patients while we are treating them with any drug, be it insulins or be it oral anti-diabetic drugs. So compliance is a big issue, and almost 55 to 70% of our patients are not compliant to our treatment which we are prescribing. With sustained release preparation, definitely we will improve the compliance as well as we will improve the pharmacokinetic profile of the drug. So it will be better efficacious, and area under curve will be much better for that.
How does the mitochondrial targeting mechanism of imeglimin influence its clinical use?
Basically, if we see the mechanism of action of imeglimin basically acts on the mitochondrial level, and by acting on the mitochondrial level in pancreas, it leads to better insulin secretion. That means it acts as a secretagogue, while in target tissues like muscle and liver, it acts as reducing the insulin resistance also. So it has got dual benefits as compared to other oral anti-diabetic drugs which have single mode of action. So while in acting in liver mitochondria, it basically reduces the gluconeogenesis, and that's why the morning blood sugars are better when the patient is on fasting blood sugar, are better when patient is on imeglimin, and it also acts on muscle tissue by increasing the glucose uptake in muscle tissues, and that action mimics the action of metformin, and it also leads to better glycemic control in my patients, and definitely the side effects are very less. So it is a very promising molecule, and probably in the times to come it will be used as monotherapy, or it can be used as the starting therapy for type 2 diabetes.
What are the key safety and efficacy findings from clinical evidences on imeglimin that clinicians should be aware of?
Basically, there are not very major side effects of imeglimin, and in most of the clinical studies it has been found to be very safe drug. Major side effects basically of or other oral antidiabetics are GI side effects, which are almost negligible in this imeglimin, and it doesn't have many side effects related to skin or muscle pain or any other side effects, and it also doesn't cause major hypoglycemia also, which is a major side effect of sulfonylurea. So it is very safe drug, though we don't have very long term cardiac safety features with this drug. So further studies are needed to establish the cardiac safety point of view of imeglimin, and then if we establish the cardiac safety profile of this drug, then probably this will come in the first line treatment of diabetes.
Do you believe that imeglimin has the potential to change the future landscape of diabetes treatment?
Definitely, because by dual mode of action and by acting on the mitochondria, because mitochondria is probably the seat of you can say pathogenesis of diabetes. So by acting on the mitochondria and by its dual mode of action, it is very promising molecule, and probably it will change the total landscape of diabetes treatment in the world. And India being the diabetes capital of the world, we will probably be the first to document all these things in medical literature.